A ruptured appendix is a serious life-threatening condition that requires immediate attention. The appendix is a small, finger-shaped pouch attached to the large intestine and located in the lower right side of your abdomen. For a long time, scientists thought the appendix was a useless organ with no important functions, but recent research suggests it might play a role in immune function. Sometimes the appendix can become inflamed, which is a condition called appendicitis. The inflammation causes the appendix to swell and fill with pus and bacteria. If the condition is left untreated, the pressure builds up too much and the appendix can burst or rupture. When this happens, bacteria and pus spill into the abdominal cavity. This can lead to a serious infection called peritonitis, which can spread quickly and become life-threatening if not treated immediately. It's very important to note here that the progression from a healthy appendix to a ruptured one can occur surprisingly fast, sometimes within 48 to 72 hours. As for the prevalence of the condition, appendicitis affects about 5 to 9% of people at some point in their lives, making it a relatively common condition. Some studies show that about 20 to 30% of people with appendicitis experience a rupture before they receive medical care. Causes of ruptured appendix. Like what we said, a ruptured appendix is usually the result of untreated appendicitis. But what causes appendicitis in the first place? Let's explore the main causes. Appendicitis often occurs when the appendix becomes blocked. This blockage can be caused by a buildup of hardened stool, foreign objects, or even swollen lymph nodes in the intestine. When the appendix is blocked, bacteria inside it multiply, leading to infection and inflammation. If untreated, the pressure inside the appendix increases, cutting off its blood supply and leading to tissue death. Eventually, the weakened walls of the appendix burst, releasing its contents into the abdominal cavity. Other factors that can increase the risk of appendicitis and a ruptured appendix include infections in the digestive tract, inflammatory bowel disease, or trauma to the abdomen. While appendicitis can happen to anyone, it's most common in people between the ages of 10 and 30. However, it's important to note that appendicitis and a ruptured appendix can occur at any age. Symptoms of ruptured appendix. The symptoms of a ruptured appendix usually start with the classic signs of appendicitis. Here's what you might experience. The first sign of appendicitis is often pain near the belly button that gradually moves to the lower right side of the abdomen over a couple of hours. This pain can start off mild, but usually becomes sharper and more intense over time. It might feel like a constant ache or a cramping sensation, and it often worsens with movement, coughing, or sneezing. Other symptoms of appendicitis include nausea, vomiting, loss of appetite, and a low-grade fever. You might also notice bloating, constipation, or diarrhea. Once the appendix actually ruptures, the pain might temporarily ease as the pressure is relieved, but this is a dangerous sign. Shortly after, the pain typically returns and becomes more widespread as the infection spreads throughout the abdomen. Many people experience a high fever, chills, and nausea. In severe cases, the abdomen may become rigid or bloated due to inflammation or the presence of an abscess. Patients may also experience an increased heart rate and difficulty breathing as the body responds to the spreading infection. All these symptoms can feel incredibly uncomfortable and scary. The pain is often described as unlike anything experienced before, and the spreading pain pattern is particularly characteristic of a rupture. At this point, the situation becomes a medical emergency, and immediate treatment is essential to prevent further damage. Diagnosis of ruptured appendix. Diagnosing a ruptured appendix starts with a physical exam and a review of your symptoms. Here's what to expect. Your doctor will begin by asking about your symptoms and medical history. They'll then perform a physical exam, pressing on your abdomen to check for tenderness, swelling, or rigidity. One common test is called the rebound tenderness test, where the doctor presses on your abdomen and then quickly releases the pressure. If this causes sharp pain, it could be a sign of peritonitis. To confirm the diagnosis, your doctor may order imaging tests. An ultrasound or CT scan can provide detailed images of your abdomen, showing whether the appendix is inflamed or has ruptured. Blood tests might also be done to check for signs of infection, such as a high white blood cell count. In some cases, especially if the diagnosis is unclear, your doctor might recommend a diagnostic laparoscopy. This is a minimally invasive procedure where a small camera is inserted into the abdomen to look directly at the appendix. If a ruptured appendix is confirmed, surgery is usually performed immediately. Treatment for ruptured appendix. Treating a ruptured appendix requires prompt medical intervention to prevent serious complications. Here are the different treatment options available. Number 1. Emergency surgery, appendectomy. The primary treatment for a ruptured appendix is surgery to remove the appendix, which is a procedure called an appendectomy. This can be done in two ways: open surgery or laparoscopic surgery. In open surgery, a single incision is made in the lower right side of the abdomen to remove the appendix. Laparoscopic surgery involves making several small incisions and using a camera and specialized tools to remove the appendix. Laparoscopic surgery is less invasive and usually has a faster recovery time. During the surgery, the surgeon will also clean the abdominal cavity to remove any bacteria or pus that spilled from the ruptured appendix. This helps prevent the spread of infection. After the surgery, you'll likely stay in the hospital for a few days to recover and receive antibiotics to treat any remaining infection. Number 2. Antibiotics. Antibiotics are a crucial part of treating a ruptured appendix. They help fight the infection caused by the bacteria that spread into the abdominal cavity. In some cases, antibiotics may be given before surgery to reduce the risk of complications. After surgery, you'll continue to receive antibiotics intravenously for several days to ensure the infection is fully cleared. Number 3. Drainage of abscesses. If the ruptured appendix has caused an abscess or a pocket of pus to form in the abdomen, your doctor may need to drain it. This is usually done using a procedure called percutaneous drainage, where a needle or catheter is inserted through the skin to remove the pus. In some cases, this procedure is done before surgery to reduce the risk of complications. Number 4. Supportive care. Recovering from a ruptured appendix can take time, and supportive care is an important part of the treatment process. This includes staying hydrated, getting plenty of rest, and eating a healthy diet to help your body heal. You might also need pain medication to manage discomfort during recovery. After treatment, it's important to follow up with your doctor to ensure the infection is completely gone and that you're healing properly. You might need additional imaging tests or blood work to confirm that everything is back to normal. If you experience any new symptoms, such as fever, abdominal pain, or swelling, contact your doctor right away. At the end, while it can be a scary condition, the good news is that with prompt treatment, most people recover fully. If you or someone you know is experiencing symptoms of appendicitis, don't wait, seek medical help right away. Early intervention can prevent the appendix from rupturing and reduce the risk of complications. Remember, when it comes to your health, it's always better to be safe than sorry. Now we want to hear from you. Have you or someone you know experienced a ruptured appendix? How did you recognize the symptoms, and what was the recovery process like? Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.